Scheduling your COVID-19 vaccine can easily feel like an overwhelming task. That is, until you get a handle on the facts. That's where we come in. Here's everything you need to know before you get vaccinated against COVID-19. According to the COVID-19 Real-Time Learning Network, at least 6 vaccines against COVID-19 have been developed or are in development as of April 2021. None are fully FDA approved, but 3 have been given Emergency Use Authorization, or EUA, by the U.S. Food and Drug Administration. The granting of an Emergency Use Authorization means that members of the public may receive the vaccine in advance of FDA approval. According to the FDA itself, FDA approval of a drug means that data on the drug's effects have been reviewed by the FDA's Center for Drug Evaluation and Research, and the drug is determined to provide benefits that outweigh its known and potential risks for the intended population. Likewise, for an emergency use authorization to be issued for a vaccine, the FDA explains the FDA must determine that the known and potential benefits outweigh the known and potential risks of the vaccine. According to the Centers for Disease Control and Prevention, as of April 2021, the 3 COVID-19 vaccines that are subject to an emergency use authorization are the ones by Pfizer-BioNTech, aka Pfizer, Moderna, and Janssen Pharmaceuticals companies of Johnson & Johnson, aka Johnson & Johnson. In a February 2021 article, the University of Nebraska Medical Center addressed the issue of whether the development processes of COVID-19 vaccines were rushed. The article summed up the remarkable circumstances in which the vaccines were developed, stating, "In a first for vaccine development, 2 COVID-19 vaccines were created, evaluated, and authorized for emergency use in under a year." None of that is to say that corners were cut. As the UNMC article emphasized, despite the fast timeline, these vaccines went through the appropriate clinical trials just like other vaccines before. Further, it's not as if the FDA just rubber-stamped the vaccines and went on to doing other things. In fact, the granting of an emergency use authorization is conditioned on continuing study and reporting on the vaccines. Additionally, one of the vaccines for which the FDA has not issued an emergency use authorization is the one developed by AstraZeneca in conjunction with Oxford University in the UK. The reason for the lack of authorization for this vaccine is reportedly because large-scale Phase 3 clinical studies on the AstraZeneca vaccine are still in progress. Thus, the FDA cannot say that the AstraZeneca vaccine is both safe and effective. It's worth noting that the FDA is waiting for safety and effectiveness confirmation on the AstraZeneca vaccine, while other nations have gone ahead to authorize and, in some cases, deauthorize its use.
Now, Denmark has temporarily halted the use of the COVID-19 vaccine manufactured by AstraZeneca.
Historically, it's taken as long as 10 to 15 years of extremely costly research in order to develop and authorize a vaccine for use in the U.S. So how is it even possible that 3 COVID-19 vaccines could have been developed and proven effective and safe enough for emergency use authorization within such a short time frame? According to the World Health Organization, one of the biggest factors speeding up vaccine development had to do with a large decrease in the need to spend time securing funding for more research. And that's been made possible by the commitment of vast resources by global governments and businesses. Second, a lot of the legwork that might have been required to develop a vaccine had already been accomplished during earlier research of previous vaccines. And by the time the novel coronavirus emerged as a threat, much was already known about other coronaviruses, which were first described in a medical journal in 1965. According to the World Health Organization, all vaccines against COVID-19 are being subjected to a multi-stage testing process that includes large-scale clinical trials. These trials are designed to identify potential adverse effects across tens of thousands of volunteers, but the evaluation of the vaccine safety does not stop there. The WHO explained, "Once a clinical trial shows that a COVID-19 vaccine is safe and effective, a series of independent reviews of the efficacy and safety evidence is required. And before a country such as the U.S. even gets to consider whether to authorize use of a vaccine, a panel of experts assembled by the WHO has to review all the existing data and decide whether to recommend the vaccine's use. By the time a vaccine has been introduced into the public, multiple systems are in place for monitoring its safety," the CDC confirmed. These include public databases of vaccine-related adverse events that healthcare providers and others can access and contribute to. You yourself can support the effort by reporting adverse events to the Vaccine Adverse Event Reporting System, the vaccine safety monitoring system managed by CDC and FDA. As of April 2021, the vaccine we know as the Pfizer vaccine was developed by Pfizer, Inc., in conjunction with BioNTech. The Pfizer vaccine regimen consists of 2 injections to the muscle in the upper arm, spaced 21 days apart. There are a number of different types of vaccines, categorized by how they work to protect the human body from infection, but the Pfizer vaccine is what's known as an mRNA vaccine. mRNA, or messenger RNA vaccines, are a new type of vaccine first approved for use in December 2020. According to the CDC, mRNA vaccines teach our cells how to make a protein, or even just a piece of a protein, that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. The Pfizer vaccine is recommended for people aged 16 and older. It does not contain eggs, preservatives, or latex, which could be important to people with allergies. Side effects of the Pfizer vaccine include pain, redness, and swelling at the injection site, and overall flu-like symptoms. The vaccine, known as the Moderna COVID-19 vaccine, currently consists of 2 injections spaced 28 days apart. Like the Pfizer vaccine, the Moderna vaccine falls into the category of mRNA vaccines. According to a CDC information sheet, COVID-19 mRNA vaccines give instructions for our cells to make a harmless piece of what is called the spike protein. The spike protein is found on the surface of the virus that causes COVID-19. The Moderna vaccine is indicated for people aged 18 and older. According to the CDC, it contains no eggs, preservatives, or latex. Common side effects of the Moderna vaccine include pain, redness, and swelling at the injection site, and flu-like symptoms. One potentially significant difference between the Moderna vaccine and the other authorized vaccines is that it's seemingly more likely to cause discomfort at the injection site. According to some media outlets, this phenomenon even has a name, Moderna arm, or sometimes just COVID arm. Like the other side effects, though, it resolves quickly in most cases.
Potentially is related to maybe a preservative that's in the vaccine, and that's maybe what is causing this reaction.
As of April 2021, the Johnson & Johnson COVID-19 vaccine, also known as the Janssen COVID-19 vaccine, calls for a regimen which consists of 1 injection to the upper arm. The Johnson & Johnson vaccine is not an mRNA vaccine. Rather, it falls into the category known as viral vector vaccines. According to the CDC's information sheet on viral vector vaccines use a modified version of a different virus, the vector, to deliver important instructions to our cells. For COVID-19 viral vector vaccines, the vector, not the virus that causes COVID-19, but a different harmless virus, will enter a cell in our body and then use the cell's machinery to produce a harmless piece of the virus that causes COVID-19. This then causes the immune system to produce antibodies and fight what it thinks is an infection. This 1-dose vaccine is recommended for people aged 18 and older. Like the mRNA COVID-19 vaccines, it contains no eggs, preservatives, or latex. Typical side effects of the Johnson & Johnson vaccine include pain, redness, and swelling at the injection site, as well as flu-like symptoms. The vaccine, known as the AstraZeneca COVID-19 vaccine, was developed by pharmaceutical company AstraZeneca in conjunction with the UK's Oxford University, according to the World Health Organization, which notes the recommended dosage as being 2 half-milliliter doses delivered intramuscularly with an interval of 8 to 12 weeks. As of April 2021, 2 versions of the AstraZeneca vaccine have been listed for emergency use by the World Health Organization, but not in the US. For those who have doubts about the FDA's emergency authorization process with regard to the vaccines that have been granted emergency authorization, it is worth noting here that the FDA reportedly does consider the fact that the AstraZeneca vaccine has been approved for use in other countries as persuasive. Nevertheless, the FDA has opted to stand down while concerns circulate over the AstraZeneca vaccine's safety, including whether it can cause a blood clot that leads to bleeding on the brain, are hashed out among scientists. According to the CDC, the Pfizer, Moderna, and Johnson & Johnson COVID-19 vaccines are all effective at preventing COVID-19. The COVID-19 vaccines authorized for emergency use in the U.S. are considered by the CDC to be an important tool to halt the COVID-19 pandemic, but their efficacy continues to be monitored and evaluated. Specifically, the Pfizer vaccine, after both doses were given, was proven to be 95% effective at preventing COVID-19 infection in clinical trials, according to the CDC's Pfizer vaccine fact sheet. In clinical trials, the Moderna vaccine was proven 94.1% effective at preventing COVID-19 infection, and the data suggests that where COVID-19 has been diagnosed, fewer people have been admitted to the hospital. The single-dose Johnson & Johnson vaccine was proven 66.3% effective at preventing COVID-19 infection in clinical trials, and may, based on preliminary evidence, protect against asymptomatic infection, according to the CDC's Johnson & Johnson vaccine fact sheet. There is an important distinction between the novel coronavirus, SARS-CoV-2, and the illness it causes, COVID-19, Dr. Catherine O'Brien explained to the World Health Organization in January 2021. Dr. O'Brien revealed, the clinical trials demonstrated that these vaccines protect people against disease. What we don't know yet from the clinical trials is whether or not the vaccines also protect people from just getting infected with the SARS-CoV-2 virus, and whether or not it protects against transmitting to somebody else. In other words, it is possible that the COVID-19 vaccines protect you from the illness, COVID-19, but not from the virus itself. And if that is the case, it might still be possible to transmit the virus to others. As of April 2021, we simply don't quite know. As such, experts are taking the position that you should operate from the assumption that after you are vaccinated, you may still be able to transmit the coronavirus to others, including people at high risk. As of April 6, 2021, a total of 108,301,234 people in the U.S. have had at least one dose of a COVID-19 vaccine, and more than 63 million people have been fully vaccinated, according to the CDC. Among the things the CDC is still getting its arms around, though, is how long COVID-19 vaccines protect people. That said, Pfizer reported on April 1, 2021, that a follow-up analysis demonstrates the Pfizer vaccine offers 91.3% vaccine efficacy for up to 6 months after the second dose. That also applies to the newer South Africa variant, thus offering further confidence in the vaccine's overall effectiveness. Immunity conferred by the COVID-19 vaccines may last far longer than 6 months, but that is the longest volunteers in the trials have been followed, according to Scott Hensley, an immunologist and vaccine expert at the University of Pennsylvania. With regard to the Pfizer and Moderna vaccines, clinical studies addressing the need for boosters are ongoing as of the making of this video. It is normal to experience injection site soreness and general malaise as side effects after receiving the COVID-19 vaccine, and these are generally understood to signify the vaccine is doing its job of sensitizing your immune system to the identified threat. However, there is a remote chance of a severe allergic reaction, which, according to Pfizer, Johnson & Johnson, and Moderna's respective FDA vaccine recipient fact sheets, would usually occur within a few minutes to 1 hour after receiving a dose. Signs of a severe allergic reaction include difficulty breathing, facial swelling, rapid heartbeat, full body rash, dizziness, and weakness. Due to this remote chance, it's recommended that you wait for some period of time after receiving your vaccination before leaving the premises. If you suspect you are having an allergic reaction, you should immediately contact 911 or go to the nearest hospital. Most people will not need to avoid, discontinue, or delay medications for underlying medical conditions around the time of their COVID-19 vaccination, according to the CDC. However, if you're taking an immune-suppressing medication, it's advisable to speak to your healthcare provider to determine best practices. Some people may wish to take an over-the-counter painkiller to prevent some of the vaccine's potential side effects. However, the CDC says that it is not known how these medications might affect how well the vaccine works. Therefore, it is best to refrain from taking such medications just before your vaccine. If you happen to be taking any of these medications regularly for other reasons and as directed by a doctor, you may keep taking them before getting vaccinated. If after receiving your COVID-19 vaccine your side effects are causing you discomfort, speak to your doctor about what you can take for relief. The CDC says it's also not recommended to take antihistamines before getting a COVID-19 vaccine, whether to prevent an allergic reaction or otherwise, nor should you get the COVID-19 vaccine at the same time as any other vaccine. President Joe Biden's goal is to open COVID-19 vaccination appointments for all American adults by April 19, 2021. As of the making of this video, whether you are eligible for the vaccine depends on your state of residence. To determine if you can get vaccinated in your area, you can contact your state health department. It is likely you'll be asked to take an eligibility quiz before signing up for the vaccine. For example, if you are scheduling an appointment with the Vaccine Administration Management System, a determination about your eligibility will be made before you can proceed to scheduling an appointment. Assuming you are eligible to get a COVID-19 vaccine, you can find the one nearest you by visiting vaccinefinder.org. In addition, you can check the websites of your local pharmacies to see if they are scheduling appointments. Your state health department will also be a good source for this information. Many vaccine providers use online scheduling systems, and many explain what you need to do if the vaccine they are offering requires a second appointment. After you schedule your COVID-19 vaccination appointment, you should pull together any documentation that you have been told by the vaccine provider to bring with you, according to the CDC. If you do not have a photo ID that shows that you reside in the state where your vaccination is to take place, you should discuss that with the vaccination center. When you arrive at your COVID-19 vaccination appointment, you should be wearing a mask and also be prepared to practice social distancing. Some providers provide you with a vaccination record card in advance. You'll need to bring that to your appointment. If not, you should be given one at your appointment, which you should keep safe. So how much will this all cost you? According to the CDC, the federal government is providing the vaccine free of charge to all people living in the United States, regardless of their immigration or health insurance status. You may, however, be asked for your insurance information. This is permissible and does not mean you will be charged for the vaccine, any related time spent at the vaccine center, or otherwise. However, your insurance company may be willing to reimburse the provider, according to the CDC. As Maggie Kurth of 538 puts it, people at the tail end of the vaccination priority list will likely be able to browse a veritable vaccine buffet. However, if you are eligible as of the making of this video, you'll probably end up getting whatever COVID-19 vaccine is available at your vaccination center on the day you get vaccinated. 538 pointed out that this is not bad news because all of the vaccines that have been authorized by the FDA for emergency use have been deemed effective and safe. Plus, the CDC advises, you should get any COVID-19 vaccine that is available when you are eligible. Do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines are safe and effective, and CDC does not recommend one vaccine over another. If your vaccine requires a second dose, there is a minute possibility that you could receive a different COVID-19 vaccine at your final appointment, according to the Cleveland Clinic. However, the CDC has stated that switching between COVID-19 vaccine regimens should be done only in truly exceptional situations, such as if the first dose vaccine is no longer available. Certain underlying conditions make the prospect of becoming infected with the novel coronavirus far more dangerous. Thankfully, none of those conditions preclude you from getting the COVID-19 vaccine. In fact, the CDC has pointed out that having any of these conditions makes it even more important that you get the COVID-19 vaccine as soon as you can. What could preclude you from getting the vaccine is having an allergy to any of the vaccine's ingredients. However, having allergies in general should not keep you from getting the vaccine, according to the Cleveland Clinic. If you are pregnant, you can still consider getting the COVID-19 vaccine, as experts believe it does not pose any specific risk for pregnant women. However, since knowledge about COVID-19 is developing in real time, a conversation with your healthcare provider may prove beneficial. The notion of herd immunity refers to a population being indirectly protected from an infectious disease, either as a result of vaccination or as a result of developing immunity through previous infection, according to the World Health Organization. Since the notion of herd immunity includes immunity through past infections, some might assume that if they tested positive for COVID-19, they must be immune.
I went through it. Now they say I'm immune. I feel so powerful. I'll walk into that audience.
That is, however, not the case. The CDC recommends vaccination regardless of whether you have already had COVID-19, because it is not known how long you will be protected from getting sick again after recovering. However, if you were treated for COVID-19 with monoclonal antibodies or convalescent plasma, you should wait 90 days before getting a COVID-19 vaccine. Even after you get your COVID-19 vaccine, your life may not change all that much, at least not at first, according to University of Chicago Medicine. There are several reasons, and they are interconnected. Although the COVID-19 vaccine reduces your risk of contracting COVID-19, it does not reduce that risk to zero. In addition, even after immunization, you may be capable of catching the virus and spreading it to others. Finally, the COVID-19 vaccines are most effective when everyone has gotten one, or at least when enough people have gotten it that we have achieved herd immunity. That said, it is not currently known what percentage of the population will need to be immunized before we reach herd immunity. In fact, it appears that we won't know we have reached it until we reach it. However, Dr. Anthony Fauci estimated, quote, somewhere between 70, 75, maybe 80% when speaking with CNBC in late December 2020. As of the making of this video, though, the CDC recommends continuing on with masking and social distancing. Given how relatively little time we've spent dealing with COVID-19, we likewise have spent even less time with the vaccine meant to protect against it. And with that lack of time also comes a general lack of knowledge. Simply put, it's altogether impossible to say for sure what long-term effects, if any, the vaccine will have, because not enough time has passed to even begin to answer that question. However, doctors and scientists are still studying this subject, and that's partly behind the FDA's requirement that vaccine makers continue to follow up on their research by collecting data on adverse effects. Moreover, the FDA, quote, undertakes a rigorous evaluation of the scientific information through all phases of clinical trials, which continues after a vaccine has been approved by FDA or authorized for emergency use. The good news is that even with our comparatively small amount of data, the science seems to indicate that we don't have much to worry about in this case. According to the Children's Hospital of Philadelphia, the evidence is strong that mRNA vaccines will not cause long-term harm. In other words, the Pfizer and Moderna vaccines do not pose any known long-term risks. And the CDC has pointed out that viral vector vaccines like the Johnson & Johnson one in general have been well studied and deemed safe for use in the past, including in response to Ebola. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest in medical science are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.